nakikiusap din naman po ako sa mga private hospitals. I know that you are business enterprises. But at this time of need for our citizens, sana po nako-consider din natin yung pangangailangan ng ating mga kababayan.
That was Health Undersecretary Maria Rosario Vergere urging private hospitals not to turn away patients seeking COVID-19 care. This even as Philippine Hospitals Association says a PhilHealth circular is forcing some facilities to refuse patients.
The state health insurer assures that a dialogue is now underway for possible adjustments in its COVID packages. Good evening, I'm Gretchen Ho.
And I'm Robbie Alampa. You're watching The Big Story. Let's start with the Health Department appealing to private hospitals not to turn away patients. This despite on-ground accounts of hospitals in Metro Manila already maxing out on their bed capacities.
To decongest hospitals, the Health Department will be stepping down care on mild and asymptomatic COVID-19 cases. Jess De Los Santos has the big story.
Social media is abuzz with accounts of hospital hopping, especially in Metro Manila. With facilities overwhelmed, some seek medical treatment even in provinces. But data from the Health Department tells a different story. As of Wednesday afternoon, DOH data shows that utilization of ICU beds in NCR is only at 79%. Of the admitted COVID-19 patients, 2 out of every 5 are mild and asymptomatic. The DOH hopes to bring that down by Friday, even by 20%. To do this, Undersecretary Maria Rosario Vergere told the chiefs they are coordinating with other agencies for the step-down care program.
We were able to identify immediately isolation facilities beds where we can be able to transfer and do the step-down care program.
Hotels, local isolation facilities, and level 1 hospitals not used for COVID-19 treatment will be tapped for the program. But Vergere clarified not all mild and asymptomatic cases will be transferred.
We have to qualify this because most of those who are admitted who are mild also have comorbidities or are elderlies.
But the Philippine Hospital Association had previously claimed that they are forced to turn away patients even if they have available beds. PHA says a PhilHealth circular prevents them from collecting co-payments, which leads to hospitals shouldering the costs. DOH appeals to hospitals to consider the needs of patients.
I know that you are business enterprises, but at this time of need for our citizens, sana po nako-consider din natin yung pangangailangan ng ating mga kababayan.
PhilHealth spokesperson Ray Balenya claimed that the state insurer's COVID-19 package are based on actual treatment cost. But Balenya said PhilHealth is already in talks with hospitals for possible adjustments.
We are glad na yan ay nailapag na sa lamesa sa discussion between PhilHealth and Philippine Hospital Association. And as I said, nag-commit si Attorney Giran that we will study it. At yun naman pong pagre-review ng ating COVID-19 packages, hindi naman po yan tumigil.
Jess De Los Santos, we are One News.
What happens now to hospitals if the rising occupancy rate forces them to not accommodate more patients? To give us answers, Health Undersecretary Leopold Vega is joining us over the phone. Undersecretary Vega, welcome to The Big Story.
Yeah, good evening to all, and good evening to Gretchen and Robin. And it's a pleasure to be around.
Yusek, let's be clear first. What is the premise here of what the health authorities are telling our private hospitals? The premise is that there is enough capacity that when they turn people away, it is by choice.
No, the premise right now is that most of the level 3 hospitals, when you talk of COVID beds and isolation beds specifically for COVID, they have a very high-risk position, especially in the big cities. The 6 big cities here in Manila, like Makati, Taguig, Malabon, and Quezon City, and Pasig. And you'd see that the rise in the number of patients coming in for the utilization of the beds is roughly in a critical position. And this is very true for the level 3. When you talk of the level 3 positions, these are the big hospitals wherein they can accommodate a bigger number of patients in an ICU setting with enough diagnostics, and definitely of a clinical or human resource with infectious disease specialists that can accommodate the number of critical and severe cases. Most of this in 6 cities, I think, and here in the metropolis, and together with the other regions in Region 3 and Region 4, they do have a critical risk position. And the thing here is the number of patients that are coming in looking for this kind of management or services, especially for the critical and severe, is kind of strained or here in Metro Manila. And that's the reason why we have been trying to make sure that the government or the retained hospitals in the metropolis would be able to expand their number of beds from 30 to 50%, especially the government retained hospitals. And they have done this, and very specific is Lung Center, wherein they have been very aggressive in terms of providing more allocated beds for COVID. So we do have enough responses for this. The situation is that it's tight because the number of new cases is really increasing, and this really dovetails with the number of people trying to access the hospitals for, especially for treatment.
Okay, that was Health Undersecretary Leopold Vega. Maraming salamat po. The Philippines logged the most number of new COVID-19 cases in the Western Pacific region this week. Tonight's big number is 71,606 fresh infections over the last 7 days. The Western Pacific reported at least 106,000 new weekly cases overall. The Philippines, therefore, accounted for 264 of at least 500 deaths in the region. Japan logged some 16,000 new cases and 200 deaths this week. Malaysia has nearly 9,000 new cases and 35 deaths. The WHO has expressed concern over the situation in the Philippines.
These are the other big stories tonight. With hospitals overwhelmed, more Filipinos opt to purchase oxygen tanks, but supply is already running low. The surge in COVID deaths is also evident in crematoriums, with demand more than doubling in March. After a recommendation from the vaccine expert panel, the FDA has approved the use of Sinovac's vaccines on senior citizens. Coronavac was previously authorized to be used only on healthy individuals aged 18 to 59. China has finally responded to the country's call for its fishing vessels to pull out of Julian Felipe Reef. But it was a tabloid editor which gave the stern warning. These big stories right after the break.
You're still watching The Big Story. I'm Robbie Alampay. Some families with COVID-infected members are buying their own oxygen tanks as most hospitals are getting full. The problem is even supplies of that are running low. Shaila Francisco with the details.
As COVID-19 cases continue to rise, more and more customers are scouring for oxygen tanks and refills in different medical supply stores in Santa Cruz, Manila. This forced some like Jason to hop from one shop to another.
Reserba po namin sa pamilya namin kasi nagkakaubusan na po ngayon dito sa Bambang. Mabuti na po may stock po kami kaysa wala.
Others like Chal opted to buy oxygen tanks online for her parents.
So yung assurance po nung availability tank tsaka no refill nagbabago po per day. So every day we look for another place.
Doctors say it might be time for families to purchase their own oxygen tanks as hospitals and COVID hotspots are getting overwhelmed.
For those patients with comorbidities, I would say it's probably not a bad idea kasi nga sobrang challenged ang ating healthcare system. Now, at least kung meron silang some kind of recourse within the home, kung kailangan man natin silang abisuhan na pumunta na sa ospital, hindi sila nagmamadali ng sobra-sobra.
But as expected, supplies of oxygen tanks are running low, prompting some sellers to pump up prices by as much as 300 pesos. In Pasig, some supplies are facing delays due to limited stock.
Supplier din po namin, nauubusan na rin po ng supply ng oxygen tank po. Kaya yung iba po, hindi na namin po sila nabibigyan ng ibang oxygen. Itong mga nandito ma'am, puro empty na po yan ma'am. Tsaka yung iba, naka-reserve na po for delivery.
The health department is urging suppliers to regulate a sale of oxygen tanks. To ensure stable supply, the DOH is also asking suppliers to prioritize hospital facilities instead of households. Undersecretary Maria Rosario Vergere says those with oxygen tanks at home still need medical assistance.
Meron po tayong tinatawag na appropriate na level ng oxygen na dapat ibigay sa inyo based on the condition of the patient. And for example, you are not sick and you do not have any respiratory difficulties, difficulty in breathing and all, baka makasama pa to sa inyo kaysa yung nakakabuti, no? Kasi too much oxygen also that we take when we are at that normal or stable condition might also affect our breathing process.
The DOH advises the public to seek a doctor or contact the telemedicine hotline once the oxygen saturation of a patient drops below 94% or if they are experiencing difficulty in breathing. Shaila Francisco, WR1 News.
It's not only COVID infections that are on the rise. Fatalities have also been increasing. Nowhere is that more evident than in crematoriums, which have seen their load more than double the past month. Can they handle the demand? Romel Lopez tells us.
What used to be a vacant lot is now filled with parked service vehicles from funeral homes. This is the scene in front of Pasay City Cemetery and Crematorium. These vehicles patiently wait for their turn to be accommodated in the cremation. Pasay Crematorium said there has been a marked increase in remains brought since March.
Nagsimula po ito nung second week ng March. Tumaas na po yung bilang ng kinikremate. Dati po, 8 lang po per machine per day. Pero ngayon po, umabot po kami ng 15 cadavers per day po per machine. Kaya po, ang aming machine po naglolok na, nagkakaproblema na rin po.
That month alone, the facility cremated 405 cadavers, when it only processed 45 in January and 63 the following month. Around 60% of these cremations were COVID-19 deaths. The facility now cremates an average of 32 bodies per day from the usual 8. The crematorium's personnel have been vaccinated against COVID-19 to ensure their safety. The facility even extended its operation until 2 to 4 in the morning to keep up with the load.
Dami na po dahil mayat-maya na po yung kinikremate. Hindi na po natigil hanggang madaling araw po inaabot.
The Pasay City local government has vowed to accommodate all cremations it could handle. Aside from Pasay, the number of cremations have also risen in Manila. From processing 10 bodies daily in February, it has now jumped to 28 per day in March. Last February, COVID-19 deaths accounted for 105 of its cremation. It has since doubled to 219 in March.
Yung February kasi usual ang ano namin, na experience namin, 8, 4 lang yung hanggang 5 o'clock, tapos yung pending namin minsan hanggang 7 o'clock lang, hindi na kami umaabot ng mas gabing-gabi.
Then come March, paano po yung nangyari?
Ayan na, nagulat na ako, ang dami na talaga.
With the spike in its cremation load, the Manila North Cemetery has implemented a 3-shift schedule for 18 cremators to accommodate the demand. For News 5, Romel Lopez, we are One News.
Stories tonight. The Food and Drug Administration has allowed the use of Sinovac's vaccine on those aged 60 and up. FDA Director General Eric Domingo says the recipient's health status and exposure risk must first undergo assessment. The China-made shot is 50.4% effective for medical frontliners, but offers full protection for clinically healthy individuals aged 18 to 59. Citing the surge in COVID-19 cases, Malacanang says President Duterte won't be addressing the public this week. On top of that, Senator Bongo said some members of the Presidential Security Group tested positive for COVID-19. Duterte last talked to the public on March 29, a day after his birthday. And General Trias Police Chief Marlo Solero has been relieved from his post following the death of a male curfew violator. Resident Darren Peñaredondo died after he was allegedly forced to perform pumping exercises as punishment. Solero will be reassigned to Imus along with 2 other officers. Time for another quick break. More big stories when we return. Keep it here on One News.
You're still watching The Big Story. I'm Robbie Alampay. China has responded to Defense Secretary Delfin Lorenzana's demand to withdraw their presence from the Julian Felipe Reef. The statement was forced through the editor of the Chinese daily Global Times, editor Hu Xijin, said Beijing is warning of a strong response if Manila acts rashly over the continuing presence of some 200 Chinese ships in the Whitsun Reef. Hu also accuses Philippine officials of hyping up the latest incursion because elections are nearing. The editor downplayed the diplomatic protest recently filed by the DFA. He said Chinese fishermen have been operating in the area for years.
I would like to warn the Philippine military that it should not act rashly other than making some noise. Otherwise, China will definitely give a strong response.
To help us make sense of that statement, we have Manny Mogato, News 5 Editor-in-Chief. Good evening, Manny.
Good evening, Robbie.
First of all, Manny, what do you make of that statement? And secondly, paki-clarify, why are we taking it out of a media outlet?
China has been adopting a gray zone strategy over the years. No, they've been using fishing boats and militia vessels to swarm the disputed area. And if we responded strongly using our Navy or our Coast Guard vessels, they would come back with the stronger force, like their Coast Guard and their Navy. So I believe that this recent statement by the editor of China, Global Times, it's a tabloid owned by the mouthpiece of the Chinese Communist Party, People's Daily, is another form of aggression strategy. They do not want to take on our defense secretary officially, so they're using the editor of tabloid.
Okay, so Manny, I mean, given that, what else can the Philippines do at this point?
Well, we have a lot of options. Well, we can file another protest, a diplomatic protest. We can go to the to the United Nations, but this will take a longer time to solve the issue. But the Philippines should show its teeth by joining our allies like the United States, Japan, and Australia in patrolling, in naval exercises in the disputed sea. In the last 2 days, we've seen the USS Theodore Roosevelt sailing into the South China Sea, and I think today they had an exercise with the Malaysian Navy, and we can do that also to show our teeth. We can send ships to the area to show our flag, but at a safe distance, not to provoke the China because it can react as the editor has warned strongly against our forces, and they can occupy again Whitsun Reef or Julian Felipe locally in the Philippines.
Okay, and we will continue to monitor this. Maraming salamat, Manny. Thank you for your time. That was News 5 Editor-at-Large, Manny Mugato.
Here are the other big stories on print and online. From the Philippine Star, former President and Manila Mayor Joseph Erap Estrada is now in stable condition, according to his son and ex-Senator Jinggoy. Erap tested positive for COVID-19 and has been hospitalized since March 28. The Labor Department will be providing financial aid worth 5,000 pesos to workers affected by the stricter lockdown. Dole tells Business World Live it is pushing for a higher wage subsidy of up to 8,000 pesos per worker. Some 10,000 workers have been displaced following the reimposition of ECQ in NCR and nearby provinces. And from News 5, the Agriculture Department says the 60-day price ceiling on pork and chicken products won't be extended. The government will instead impose a suggested retail price on imported pork. Poultry and locally sourced products won't be covered by the SRP.
In is very kind, not a bad boy after all. Alam mo,
I saw that a while ago. That was so cute. It was a Labrador.
alam mo ang mga aso kalaban talaga ng media nowadays eh. Kahit sa virtual, hindi ko alam kung naririnig mo ilang aso pinapatahimik ko dito hanggang kapitbahay.
Yung sa akin naman, naglalakad dito sa likod. Pero nandun, naka-quarantine siya ngayon pag may newscast tayo.
Anyway.
We acquired the dog to relieve stress from the pandemic. So let's thank that Labrador for breaking into our screens.
Sige,
That
wag
wraps
naman
up today's
gulo.
Catch us again tomorrow on Signal Channels 8 and 250.
Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph.
Mask on, wash hands, and stay safe, Philippines.
And stay negative, be positive. Kaya natin to. I'm Robbie Alampay.
And I'm Gretchen Ho, and we are One News. Have a good evening.
Good evening.